I'd like to say a few other words about how we take collective responsibility for keeping each other safe. Well, I say let's heed our experts and listen to what they say. When they say keep 6 feet away from other people and to avoid public places, that's what we should do, unless, of course, we're childcare providers or work in the hospital setting or have to work in a market. So that also means keeping 6 feet away from people in our households who are at increased risk of very severe illness if they do get infected. So I had to tell my son that does not mean playing pickup basketball, okay? Um, the other thing is, I always think as a physician, where have my hands been? I worked in a hospital setting where there are lots of infections, so I was conscious of whatever I touched. So if you're going out, make sure that you don't touch your face after you've touched a surface in a public place. And you come home, you wash your hands, or you use hand sanitizer if you have access to it. And you might also think, for those of us who are on our phones 20 times a day, that maybe you should clean your phone case, your keyboard, if you haven't done so, on doorknobs, those sorts of things. Finally, I would say that if you do have symptoms such as high fever, a headache, some difficulty breathing, a sore throat, loose stools, those might be symptoms of COVID-19 and you should call the clinic. But if you don't have those symptoms or unsure, check the Minnesota Department of Health to see whether your symptoms warrant testing. And certainly before you go for testing, call the clinic so that they are prepared for you. Certainly if you're having difficulty breathing, really high fever, feel lethargic, maybe call and see whether or not you should go to the hospital. Okay, let's keep each other safe. It's all our responsibility. Thanks.